In this video, we'll talk about the three cardinal or primary planes of motion, the frontal, sagittal, and transverse planes, which bisect our bodies in different halves. Within each plane, we'll define and see examples of different joint motions: abduction, adduction, lateral flexion, retraction, and elevation in the frontal plane, flexion, extension, plantar flexion, and dorsiflexion in the sagittal plane, and horizontal abduction, horizontal adduction, internal rotation, external rotation, pronation, and supination in the transverse plane. In addition to the planes and joint movements, we'll also define key positional terms: anterior, posterior, proximal, distal, superior, inferior, medial, lateral, and ipsilateral, contralateral, unilateral, and bilateral. Note that these are not the only joint motions our bodies can make. Rather, these are the stereotypical ones that easily pair with common muscles. Speaking of which, along the way you'll learn the major muscles that help create these different joint movements and identify the key bones and joint articulations of the appendicular skeleton. Before we begin in on the planes and joint movements, we need to consider our body's reference position, known as the anatomical position. Standing up straight, looking forward with feet about shoulder width apart, and the arms down near the sides with the palms facing forwards. The joint movements, as defined, will either move our body away from or back towards this anatomical position. Frontal plane. The frontal plane divides your body into a front half and a back half. Any joint movements that mirror this plane are said to be frontal plane motions. When we move our limbs away from our body in this frontal plane, it's called abduction. Moving back towards the anatomical position is adduction. Properly identifying a joint motion includes calling up the joint and then the motion. For example, this is shoulder abduction, followed by shoulder adduction. And this is hip abduction and hip adduction. Both the shoulder and hip joints are ball and socket joints, which allow for a great deal of movement. Another common frontal plane motion is lateral flexion. We see this commonly at the neck and at the trunk. The other two frontal plane motions are harder to visualize as they occur around our scapula or shoulder blades. When we shrug our shoulders, we create scapular elevation. And when we draw our shoulders back, it's called scapular retraction. Sagittal plane. The sagittal plane divides your body into a left half and a right half. Any joint movements that mirror this plane are said to be sagittal plane motions. Beginning again with our shoulders and the hips, when we move away from the anatomical position in the sagittal plane, it's called flexion. Returning to our reference position is extension. So here we see shoulder flexion and shoulder extension, and then hip flexion and hip extension. Unlike abduction and adduction, we see flexion and extension in other joints. This is elbow flexion and elbow extension. And this is knee flexion and knee extension. The neck, trunk, and wrist can also flex and extend. This same motion at the ankle has a special term. Plantar flexion is the motion of going up on your toes like a calf raise, while dorsiflexion is the opposite, like trying to walk on your heels. Plantar flexion and dorsiflexion, because they only relate to the ankle, do not require you to say ankle plantar flexion or ankle dorsiflexion, as it's redundant. These terms only apply to the ankle. The term hyperextension means extension that goes beyond the anatomical position. We commonly see this at the shoulder, hip, neck, and trunk. We generally do not want to hyperextend the knee and elbow joints. The knee joint is known as a bicondylar joint, while the elbow is a hinge joint. You might think they're the same, but the knee allows for a little bit more movement, mainly twisting, than the elbow does. Transverse plane. The last cardinal plane is the transverse plane, which divides your body into an upper half and lower half. Joint movements that mirror this plane are called transverse plane motions. Our two ball and socket joints, the shoulders and hips, provide good examples of transverse plane motions. Horizontal abduction is movement within the transverse plane, which moves away from our body's midline, while horizontal adduction is the opposite. This is horizontal abduction, and horizontal adduction at the shoulder. This is the same motion at the hip. Also at the shoulder and hip, we can create internal rotation and external rotation. Internal rotation is turning inwards towards your midline, while external rotation is the opposite. It's easier to visualize internal and external rotation at the shoulder if you first flex your elbow to 90 degrees. Finally, at the wrist, we can create pronation and supination. Like plantar flexion and dorsiflexion we discussed earlier, pronation and supination are nearly exclusive to the wrist, so you do not need to state wrist pronation. However, you may have heard people discuss their feet or gait as either pronators or supinators, which refer to walking more on the inner part of your foot or the outer part, respectively. People may wear special shoes or have special inserts to account for this. Basic anatomical terms. We've covered the 3 cardinal planes and have seen examples of common joint movements with each of them, and have even defined a few joint types. Let's next define some basic anatomical terms and then get into learning about the muscles which create these movements. The term anterior means towards the front, whereas posterior is towards the rear. Again, we are using the anatomical position reference for this. The biceps are anterior to the triceps, and the hamstrings are posterior to the quads. The terms proximal and distal refer to our limbs. The proximal portion of a limb segment is near the torso, while distal is further away. The elbow is proximal to the wrist, and the ankle is distal to the knee. Body parts that are superior are closer to the head, while inferior is closer to our feet in our basic anatomical position. The neck is superior to the waist, and the ankles are inferior to the hips. The terms medial and lateral refer to how close to the midline, dividing our body into a left and right half, something is. From our anatomical position, the chest muscles are medial to those of our forearm, while our ears are more lateral than our nose. Finally, the terms ipsilateral, contralateral, unilateral, and bilateral refer to sides of our body. Ipsilateral means on the same side. For example, when throwing darts, if you throw with your right arm, you also generally have your right leg in front of your left. In other words, when throwing darts, you lead with the ipsilateral leg. This is the opposite of bowling, for example, where we typically step with the opposite leg when releasing the ball. When bowling, it's best to step with the contralateral leg. The terms unilateral and bilateral simply mean that you either use one side, unilateral, or both sides, bilateral. When performing dumbbell curls, a person may choose to perform them unilaterally, one arm at a time, or bilaterally, both arms at the same time. Lower body muscles. We're down to the major muscles and bones involved in common joint movements within the 3 planes. Consider how the vast majority of movements we do on a daily basis involve multiple joints moving across multiple planes. This means even a relatively simple movement like a push-up involves several joints and thus several muscles. Walking and running also involve multiple joint movements and muscles. Let's start from the ground up. At the ankle, we can create plantar flexion. The 2 main muscles which cause this are the soleus and the gastrocnemius. Combined, we generally refer to these as the calf muscles. To create dorsiflexion, we mostly use a muscle called the tibialis anterior. You remember that anterior means front, and the word tibialis refers to the shin bone called the tibia. There's another non-weight bearing bone in your lower leg called the fibula. Around the knee, we create flexion and extension. The flexors are the hamstrings, the semimembranosus, the semitendinosus, and the biceps femoris. The word femoris refers to the name of the thigh bone, the femur. It's also worth knowing that the gastrocnemius, one of your plantar flexors, is also involved in knee flexion. The soleus is not. The 4 main knee extensors are known as the quadriceps: the vastus medialis, vastus lateralis, vastus intermedius, and the rectus femoris. Again, we have the femoris word, which refers to the femur. The 3 vastus muscles have names that indicate where they're located: towards the midline of the body, medialis; away from the midline of the body, lateralis; or between the 2, intermedius. Remember that terms medial and lateral refer to the midline of the body, so that's where these terms are used. At the hip, Like the shoulder, we have a lot of movements and muscles to consider, but we'll keep things simple. To create abduction at the hip, we use our hip abductors, and for adduction, we use our adductors. To create hip flexion, we use our hip flexors, one of which is the rectus femoris, one of the quads we mentioned earlier. However, for hip extension, it's important to take a deeper examination. The primary muscle involved in hip extension is the gluteus maximus, but it's very important to understand that the hamstring muscles, semimembranosus, semitendinosus, and biceps femoris, are also involved in hip extension. That's right. Similar to the gastrocnemius, which creates both plantar flexion and knee flexion, the hamstrings both flex the knee and extend the hip. The final thing related to the movements about the hips is to mention that we refer to this bony structure as the pelvis. Although we mentioned internal and external rotation around the hip, we won't get into the muscles which create these specific movements, and instead simply consider them internal and external rotator muscles, like we did with our abductors and adductors. Upper body muscles. Let's move up to the muscles related to the wrist, elbow, and shoulders, since they, in many ways, mirror those of the ankles, knees, and hips. If we imagine our wrist to be similar to our ankle, we can create wrist flexion and wrist extension like we create dorsiflexion and plantar flexion. For simplicity, we'll refer to these muscles as our wrist flexors and wrist extensors. Do you remember the other motions we mentioned about the wrist? Supination and pronation? We'll just call these muscles our supinators and pronators. Again, no need to preface this with wrist, since these motions are basically constrained to this one joint. Being a hinged joint, the elbow has only two movements around it: elbow flexion, created by the biceps brachii, and elbow extension, created by the triceps brachii. The bones of the forearm are known as the radius and the ulna. When in our anatomical reference position, the radius is lateral to the ulna. The bone of the upper arm is the humerus. Like the hip, there are many motions around the shoulder, and we'll initially focus in on just one muscle group, the deltoids. The deltoid muscle group consists of an anterior, front portion, a medial, side portion, and a posterior, rear portion. Each head of the deltoid creates a different movement. The anterior head causes shoulder flexion, the medial part creates shoulder abduction, and the posterior portion causes shoulder horizontal abduction. Torso or trunk muscles. We're almost done, but we still have some very large muscles to consider. The human body is well designed to move around and manipulate our environment. Our biggest, bulkiest, strongest muscles are located close to the center of our body. Compare the size of the muscles of your calf compared to your thigh, or your forearm compared to your upper arm. Extend this even further by thinking how big the muscles are around our hips, chest, abdominals, and back. The more central we look, the bigger the muscles get. Our primary muscle, which makes up our chest, is called the pectoralis major, and its primary joint action is shoulder horizontal adduction. In our upper back, we have three muscles to think about. The trapezius causes scapular elevation, the rhomboids create scapular retraction, and the latissimus dorsi helps create shoulder extension and shoulder adduction. The term scapular refers to the bones that make up our shoulder blades, the scapula. The bones you think of as your collarbones are your clavicle. Our final muscles cause our trunk to flex and extend, both in the sagittal and in the frontal planes. The rectus abdominis causes trunk flexion in the sagittal plane, while the erector spinae in our lower back does the opposite, trunk extension. Our oblique muscles, primarily located laterally to our rectus abdominis, create trunk lateral flexion in the frontal plane. We've simplified things, but this is a good start for most coaches, physical educators, and fitness specialists. You may find it necessary or desirable to learn more muscles, bones, and joint actions, but the hope is that understanding the basic planes of motion and joint movement terminology will provide you with a solid base from which you can expand your learning.